And all of these studies supported your findings in your report in April 2011 that there was zero possibility that this was the cause of Michael Jackson's death.
Correct.
Now, knowing that this was a claim being put forth as a possibility by Dr. White,
Objection. That
did you?
That misstates.
I'll sustain the objection to the phrase. Re-ask.
Knowing what you read in Dr. White's report and what he wrote in his report, did you then pursue conducting a study in human volunteers to get human data on the oral bioavailability of propofol?
Yes.
And to your knowledge, prior to doing that, had there been any human studies regarding the oral bioavailability of propofol?
Not that. It's an interesting question. A company was engaged in looking at this study, at this question, and they may have conducted studies, but they have not been published.
Okay.
And so I don't know whether they studied it in humans or not, but certainly there was nothing published that I could find on human research.
And do you know why that was, that there had been no published manuscripts on this topic?
I think the answer was considered obvious, that it wouldn't be bioavailable, and so it wasn't an interesting question.
Did you then do and participate in conducting a study in Chile with human volunteers?
Yes, I did.
And was that done with Dr. Pablo Sepulveda, an anesthesiologist in Chile?
Yes, it was.
And who is Dr. Sepulveda?
Dr. Sepulveda is a professor of anesthesiology in Chile, and a personal friend. And he is one of the leaders, both in Chile but also internationally, in contemporary studies of pharmacokinetics of intravenous anesthetics. He's also the past president of the Chilean Society of Anesthesiologists and was the host of the conference that I attended in Chile in May.
And when you attended this conference in Chile in May, I assume this was a conference with respect to your field of study?
Correct.
And did you at that time ask Dr. Sepulveda if he would help conduct this study in humans regarding the oral bioavailability of propofol?
Yes.
And did he agree to work with you in conducting that study?
Yes.
And were results obtained from human volunteers that actually consumed propofol by simply drinking it?
Yes.
Okay. Can you describe the basic parameters of the study? How many subjects were involved? How much did they drink? Things of that nature?
There were 6 subjects in the study. The first 3 drank 20 milliliters of propofol. And
let me just stop you for one moment, Doctor. 20 milliliters of propofol is 200 milligrams?
That is correct.
And a 20 milliliter bottle is what's represented here in People's 102, the smaller size vial?
Correct.
Okay. And the 20 milliliters...
Judge, in light of the fact that we have...
Just a moment. If you want to address something by speaking, I
this
think
is
we
not
do it
gonna
at
be-
sidebar.
Yeah.
Okay? Thank you. Overruled. Mr. Walgren?
Thank you. Dr. Shafer, Peoples 102, at 10 milligrams per milliliter, a 20 milliliter bottle then is 200 milligrams of propofol, correct?
That's correct.
And so, I'm sorry, you said that 3 volunteers drank,
200 milligrams.
okay, and there were other volunteers in the study?
Yes, and the next 3 drank twice that dose, 400 milligrams of propofol.
And with these 6 subjects, 3 of them drinking 200 milligrams, 3 of them drinking 400 milligrams, was a conclusion drawn, was data collected from the result of these individuals orally consuming the propofol?
Yes. First, pulse oximetry was measured, blood pressure was measured, and sedation was measured using a common scale to assess sedation that we use in anesthesia. Additionally, at regular intervals, blood was taken from a vein in the arm and was measured for propofol.
So the level of sedation then was measured in each of these 6 subjects?
Repeatedly.
And what is the observer's assessment of alertness and sedation?
That is the name of the scale. That's the name of the scale that we use, the observer's assessment of alertness and sedation. And it's a common, and we say validated, which means it's been checked. It's a common validated scale in anesthesia studies.
And based on this scale, were any of the 6 subjects, either the 200 milligram or 400 milligram, were any of them sedated at any time as a result of orally consuming the propofol?
No, there was no sedation at any time following oral consumption of propofol.
And you indicated that there were oxygen saturation was measured continuously throughout the study?
Yes.
Did the level of oxygen ever drop?
No.
And you mentioned blood pressure. That was measured continuously throughout the study?
It was?
And did the blood pressure ever drop in any of the subjects throughout the study?
No.
And did you actually just last week present this study as or did you present this to a body of individuals?
The study was presented. Unfortunately, I missed the presentation.
And it was presented where?
It was presented at the meeting of the International Society of Anesthetic Pharmacology in Chicago last Friday.
And what is that conference or that meeting?
This is a society that goes back about 25 years, and it's the primary society that brings together scientists and doctors interested in the pharmacology of anesthetic drugs. So it holds a wonderful meeting, sorry for the ad, once a year. And in my view, it really is the place where all of the sort of breaking science in the field of pharmacology and anesthesia is presented.
Objection to relevance.
Overruled. Next question, please.
And at this same conference where this, well, let me put it up here, the next slide. Is this the, essentially the heading of the study that you just described entitled The Bioavailability of Oral Propofol in Humans? And could you please list off the 3 authors of that study?
Yes. This was presented, I wasn't there, but it was put on a poster and presented. And Victor Contreras is the person who was primarily doing the study with Dr. Pablo Sepulveda, the second author, and I am the 3rd author listed there. I did the analysis and wrote the paper.
And this slide accurately depicts what you've just referenced, that the measurable sedation, none, oxygen desaturation, none, and drop in blood pressure, none.
Correct.
At that same conference just this past Friday, were you also the recipient of a Lifetime Award?
Yes, I was.
And what was that, Dr. Shafer?
It's a Lifetime Achievement Award for my work in anesthetic pharmacology.
Going to the last slide, again showing the heading of your manuscript and the statement, there was no effect of oral propofol. Is that, in fact, the conclusion and the findings from that human study that you conducted in Chile?
Yes.
Now, was it this trial and your review of Dr. White's report one of the reasons you pursued this human study?
Yes.
Was it the only reason?
No.
What was the other reason?
There is an effort by the DEA, Drug Enforcement Agency, to make propofol a restricted drug in the sense that it has to be handled almost as though it were something like morphine. And it was my view that the publicity about the possibility of Michael Jackson drinking propofol might be one of the reasons that this is being pursued by the Drug Enforcement Administration. My personal belief is that patients will be hurt if propofol is scheduled.
Why is that?
This is a drug used to maintain anesthesia. Anesthesiologists have to be able to have ready access during anesthesia, because if you run out, the patient will wake up. You have to be able to have access to the drug quickly. And anything that blocks that access, such as additional paperwork requirements, I believe places patients at increased risk. So I believe this study, by showing the drug cannot be abused orally, means that if the drug is abused, it will only be done with an intravenous route, which limits the vulnerable population to healthcare providers. The general public typically doesn't have IVs and things like this available the way they can just drink a drug. So I felt that it addressed an important question in the dialogue about propofol, what's called scheduling, restricting propofol and placing paperwork hurdles to have access to it.
Then, Dr. Shafer, on the topic of the lack of oral bioavailability of propofol, you rejected that theory from the outset, as you put and concluded in your April 2011 report.
I rejected that theory in our initial